Hello and welcome again to this edition of Meet the Candidates on WCMU. I'm David Nicholas. We are speaking with our guests virtually, joined this time by Beth McGill-Rizer. She is the Democratic candidate in the race for Michigan's House District 101. Congratulations on the win in the August primary. We appreciate you joining us here today.
Well, thank you very much, and I appreciate you asking me to be here and giving me the opportunity to talk to voters.
In that first minute or two, then, tell us a little bit about yourself, your background, and the experience that you bring to the campaign.
Okay. Well, I'm actually from downstate originally. I grew up in Mason, Michigan, which is a rural community, much like much of my district right now. I attended Michigan State. However, I do have a CHIPS alumni amongst us in our family. I became interested in politics when I was very young. Always had an interest, wasn't really active until the 2016 election. And when I woke up on November 9th and realized that the least qualified person had just been elected president of the United States, I knew that my family was in jeopardy. You see, all three of my children and my grandchildren benefit from the Affordable Care Act, and I knew that was going to be in jeopardy. So I decided that I was going to have to come out from behind the keyboard and do some work. And I was relocating to this area. I got involved with the Mason County Democratic Party. I've been working with them for the past few years as an activist, and I was asked this last fall if I would consider running for office. And after discussing it with my family, I agreed to run.
As one challenging for this particular seat, House District 101, what have you and the voters that you have been speaking with during the campaign identified as the key issues? You mentioned the issue of health care, but in addition to that, or perhaps starting with that, what would you identify as the major issues that the voters and you are looking at this fall?
As we talk to voters, the number one concern that people have right now is obviously their health and care that they continue benefits. Many people, when they lost their jobs, also lost their health care coverage, and they're worried about that. They're worried about being able to pay their bills. Some people lost their jobs and may get them back, and some people have lost their jobs and they won't get them back. A lot of small businesses in our district are suffering because they are unable to open yet. But the safety and security of this district is going to be my highest priority. I value people's lives. I also value their livelihoods. We can help them replace their livelihoods, but we can't replace the lives of their loved ones.
If we look at then that intersection of the public health and also the economy, what would you as candidate now, and should you win this office, look to in terms of minimizing the impact that we've seen so far and moving ahead perhaps to provide more protection or strengthening of not only the health care but also the economic base for the district if you are elected?
Well, I think everything actually works around one particular thing, and that is clearly our economy. And to rebuild our economy in Michigan, we really need to build and expand our infrastructure. I think COVID showed us a lot of things that are wrong with our infrastructure. We'll be lucky if we make it through this session without my broadband going out on me. And I actually had to switch. I'd been using a hotspot for a couple of years because that's what we could get. Broadband in my area, it's really hard to get. When you've got kids who are trying to learn, can you imagine 3 times in a half hour getting booted off? The frustration of a parent who's been working all day long, trying to maneuver that system, or a child holding their attention to be educated. So rebuilding our infrastructure is a high priority. It also intersects with healthcare because during the COVID crisis, the use of telehealth. My husband's a physician. Trying to do telehealth from our house was not always easy. Sometimes there were days where he just had to go into the hospital, even though we were being asked to stay home. Obviously, he was essential personnel, he could go in. But our telehealth and his patients, they didn't necessarily have the technology to be able to use telehealth, whether it was the broadband or the cellular service. So all of this is built around our infrastructure. Now, the good thing about our infrastructure is those create really good jobs, good wages, good benefits. And those folks then are going back to work. That means fewer people that we have to try and find health care coverage for. Now, I'm hoping that our federal government comes up with a plan that will cover everyone. That's not my wheelhouse, but what is my wheelhouse on the state level is when all those people finally get covered, they're going to need health care providers. And along with those providers, we're going to need the ancillary staff. And so our goal at the state is going to have to be, how do we recruit providers to our area and how do we keep them here? A couple things that we can do is improve our infrastructure, because as young families come into a community, they're looking at the schools, they're looking at the parks. They want to know that this is a good place to live. And if you have good infrastructure, they're more willing to live someplace like that.
How then do you propose, should you be sent to Lansing, to come up with the funding or reallocate funding to invest to that level in the infrastructure and or help the officials in Lansing advocate to the federal level for that level of investment in the infrastructure to address these concerns?
Well, that's the beauty of infrastructure. When those people go back to work, all those people we're going to put to work on infrastructure projects, they're going to start paying taxes. That's money that goes into for revenue so that we can spend money. So that's the best way to get more money, is to put more people to work. We're also going to have to look at what we're spending. What are we spending it on? Is it necessary spending? Can we spend differently? No, we're not going to get out of this unscathed. I don't have any illusions about that. I know that we're going to have to make cuts, and they're probably going to be painful. But I think that we have to take every opportunity that the federal government offers us for funds. We have to look at private and public grants as ways of acquiring funds. But getting people back to work is the best way for us to increase our revenue.
If we look at the state budget then, or from the perspective that at least you are afforded as a candidate, what do you see in the budget and the spending choices and commitments right now? And what are the voters saying to you as where they see where changes could be made in the state plan to address something such as this issue that we're speaking of, the infrastructure and its impact then potentially towards public health and the overall economy?
Well, I think that you have to take your priorities, establish what your state priorities are. And the people in my district care about the economy, the infrastructure, healthcare, and education. Those are the important things to them. And they also want us to do it by keeping our air clean and our water clean too. So take those issues, they all intertwine, and then set your budget based on your priorities. Now, we spend an awful lot of money on corrections. We spend more money on a prisoner than we do a student. And we know that if we were to invest in early childhood education, that we have better outcomes for our adults. So we're going to have to look at how can we reallocate money in such a way that we're looking at a long-term instead of a short-term solution. I think one of the things that we see in our prison population right now are a lot of people who don't belong there. Our corrections officers are overworked and overburdened by how many people are in the system. Crime is down, but the number of people who are incarcerated is up. So what can we do to get people out of the prison system safely? We have to keep our communities safe, but get them the services they actually need, whether that's drug rehab services, mental health services. We had a person who was incarcerated locally that the only reason he was incarcerated was there was nowhere for him to go. And it wasn't safe for him to be on his own because there was no bed available.
You also mentioned education in connection with this regarding providing more educational opportunities for those who have been incarcerated or addressing this before they would become part of the prison population. In addition to also the issue of the broadband and the other challenges facing schools, especially in our rural districts, what would you then address as other primary concerns for education, not only statewide, but specifically in District 101?
Well, I consider learning a lifetime experience. So we need to start at the very beginning, which is with good quality childcare, whether that's provided in a center or in the home setting. My children actually were in a home setting the majority of the time, and their provider did provide early childhood education for them. Then we need to travel through all the way through. I believe that four-year college should be free. We're not going to get there right away, but I'd like to see the point where we look at K through 16 as the normal. Now that from 12 to 16 may look different. It might be a vocational program. It might be a community college program. We're fortunate we have the Promise Scholarship here, affords kids 2 years of college. I'd like to see an emphasis put on vocational training. For instance, we talked about recruiting healthcare providers to the area. Well, how about we grow some of our own healthcare providers? When students show an interest in the healthcare professions, let's have an avenue for them to acquire the skills needed to start out in a career upon graduation, or have the basis to go on to school for other career levels, physicians, nurses, physical therapists. Those are things that we can do with education, but we have to make sure it's available.
Do you support an expansion of the community college program then, or what other options might there be to offer more when it comes to vocational training, of which you are hoping to do?
Well, vocational training, I actually attended a career center when I was in high school. That's an option, having a regional career center. And at one point they were talking about doing that here, and it got eliminated and turned into a prison instead. That's unfortunate. But yes, expanding community college, maybe moving some of those skills that we took out of the high schools, like shop and welding and automotive. Some of those things that, when I was in school, those were the norm. Now, not so much. Now, the other thing is we're fortunate. A couple of our areas in our district have easy access to community college. Having those expanded programs, and the kids are able to dual enroll in programs as well. And apprenticeships. I was talking to a person up in Leelanau County, and one of the things that he did, he's a farmer, and he teaches kids during the summer. He had interns and did organic farming. We need to look at different types of internships. We know the unions offer apprenticeships. Those are learning opportunities as well.
In our final half minute, then, what would be a final message that you would want to leave for the voters as they get set to go to the polls?
I believe that this district needs a strong leader, and I believe I am that leader. As a result of my education and my experience in healthcare and the U.S. Army, and as a community activist, I bring a varied background, and I'd like to take that background and put it to work in Lansing.
Well, thank you very much for taking the time to speak with us and the voters today, and we wish you all the best for the remainder of the campaign. Thanks again.
Thanks for your time, David. I appreciate it.
We've been speaking with Beth McGill-Rizer. She is the Democratic candidate for Michigan's 101st House District. Following Michigan election laws, all qualifying candidates were invited to participate in this series. We invite you to join us again as we continue our conversations, and we certainly encourage you to get out and exercise your right to vote on Tuesday, November 3rd.